Hello friends, welcome to Knowledge Bytes. Friends, we will learn the management of breast cancer and this is the first video. In this first video, one question is framed and in question it is written as 50-year post-menopausal woman with heart lump measuring 6 into 4 cm in left breast. It is fixed to pectoralis muscle but free to skin. Fixed axillary lymph node on same side and metastatic lymph node in the other axilla, and there is no clinical evidence of visceral metastasis. For few people, these questions are easy, but I will make you understand this question more betterly if I teach you all that about the TNM staging. So, starting with the TNM staging, then only we can understand this question. TNM staging, and the TNM staging which we are going to study is the 8th AJCC classification, which is the latest classification. In this TNM, T represent the size of tumor, N represent the involvement of lymph node, and M represent the involvement of metastasis. Firstly, we will look upon the T of TNM. T represent the size of tumor. T0, it means there is no no tumor. T1 represent the size of tumor is less than or equals to 2 cm. T1 microscopic, it represents the size of tumor is less than 0.1 cm. T1A represent the size of tumor in between 0.1 cm to 0.5 cm. T1B represent the size of tumor in between 0.5 cm to 1 cm. And T1C represent the size of tumor in between 1 cm to 2 cm. T2 represent the size of tumor is more than 2 cm but less than 5 cm. T3 represent the size of tumor more than 5 cm. And T4, it is further classified into 4 types, that is T4A, T4B, T4C and T4D. T4A represent involvement of chest wall, means now tumor has involved to chest wall. The involvement of chest wall, the structures involved are the ribs, serratus anterior muscle, intercostal muscles. But the structures which are not involved, they are pectoralis major muscle, this is not involved, and pectoralis minor muscle. These two muscles are not involved. Pectoralis major muscles and pectoralis minor muscles, they are not involved. Now talking about T4B, it is the tumor cells have now invaded to skin, means invasion of skin is present. Invasion of skin, tumor cell has now invaded the skin, and now the breast will look like a purdy orange. Purdy orange means there is involvement of skin, then you can see ulceration in the skin and satellite nodule. But remember, dimpling or puckering or retraction or adherent to skin, these three are not the involvement of skin. T4C represent T4A plus T4B, means the involvement of chest wall and involvement to skin. T4D, T4D represent inflammatory breast cancer. Inflammatory breast cancer, it means More than one third of breast show purity orange, and T4D has the worst prognosis. We have completed with the T of TNM. Now we will see the N of TNM. N represents the lymph node involvement. When it is written as N0, then it means there is no lymph node involvement. N1 represents mobile axillary lymph node. N2 is further divided into N2A and N2B. N2A represents fixed matted axillary lymph node. And N2B represent internal mammary lymph node involvement, but no axillary lymph node involvement. Axillary lymph node is not involved in the N2B. N3 is divided into N3A, N3B and N3C. N3A represent infraclavicular lymph node involvement. N3B represent internal mammary lymph node involvement plus axillary lymph node involvement. Remember, I have told you that in N2B internal mammary lymph node involvement is there, but no involvement of axillary lymph node. But if axillary lymph node is involved with internal mammary lymph node, then it will be N3B. And N3C represent supraclavicular lymph node involvement. These are the ipsilateral lymph node involvement. But if contralateral lymph node is involved, when contralateral lymph node is involved, then it means that the metastasis is present. It is a metastatic disease. Okay, metastatic disease is present. Now we will talk about the M of the TNM. M means the metastasis. M0 represent no metastasis. M1 represent distant metastasis is present. So the breast cancer, where does it metastasize most commonly? Most commonly it metastasizes to bone. And if the question asks which bone is most involved, then it is the vertebral bone. And which vertebra is involved mostly? Then the answer is lumbar vertebra. Why there is involvement of the bone, ultimately the lumbar vertebra? It is due to the Batson plexus. Batson plexus is a valveless vein. The type of bony deformity is osteolytic, and it is also osteoblastic. It can be osteoblastic, but the incidence of osteolytic is more than osteoblastic. Now, if it is written as CTNM or PTNM or RTNM, MTNM, YTNM, ATNM, what is the meaning of all these prefixes? In CTNM, C represents clinical TNM. When the surgeon clinically feels the is there is present of lymph node or not, then that will be the clinical TNM. But when there is CTNM, in CTNM, when you get no lymph node, then you can do the PTNM. Here the PTNM represent the pathological TNM. Here R represent the recurrent tumor, M represent the multiple tumor. R does not represent the radiological tumor, it represents the recurrent tumor, and M represent the multiple tumor. Y represent after giving chemotherapy, that is after neoadjuvant, and A represent the autopsy. Now we have completed with the TNM staging. Now we will again go back to check that question, what it was saying. The question was saying that it is a 50 years old female with heart lump measuring 6 into 4 centimeter in size in left breast. It is fixed to pectoralis major muscle. We have got the 1 data and 2 data, but free to the skin. Fixed axillary lymph node on the same side. Fixed axillary lymph node on the same side and metastasis lymph node in the other side. We have got the 3 datas, that is the size of the tumor is more than 6 centimeter into 4 centimeter, then it will be either T3 or it will be T4. Fixed to pectoralis major but free to skin, and there is no and there is presence of metastasis. Metastasis is present. We have got the 3 datas: fixed to pectoralis major muscle but free to skin, fixed axillary lymph node on the same side. It is written as fixed. Then what will be the staging? TNM staging. You can see that there is no involvement of pectoralis major muscle, then it would be T4A, then it will be T3. It is fixed to the fixed axillary lymph node is present, then it will be N2A, and the tumor is metastasis has occurred, then it will be M1. I think I am clear to you all. So the staging of this question is T3, N2A and M1. This was all about the TNM staging. Thank you.